Bismillahirrahmanirrahim. So the next topic is acute drug-induced interstitial nephritis. So the disease is actually caused by the inflammation induced by a certain drug. The inflammation is mostly immune mediated, and the drugs that cause the disease include certain NSAIDs, sulfonamides, and synthetic penicillins, which include methicillin and ampicillin. The next is rifampicin, which is used in the treatment of tuberculosis. And the uric acid lowering drug allopurinol is also known to cause acute drug-induced interstitial nephritis. Moreover, thiazide diuretics are also known to cause the disease. So coming on towards the pathogenesis, once the drug is taken, it acts as a heptin and it binds to the cell membranes and certain plasma proteins and start acting as the antigens. So what are the heptins? Let's say this is a small molecule and this is a protein. So none of these two entities act as an antigen on their own, but when these two combine together and the small molecule binds to a specific protein, it starts to act as an antigen. So this molecule is known as a heptin. So these drug heptins act as the antigens and cause inflammation by either type 1 hypersensitivity reaction, which is mediated by IgE antibodies, or there could be type 4 hypersensitivity reaction, which is mediated by T cells. In either cases, there is damage to the tubular cells and basement membrane of the tubular epithelium, resulting in inflammation and damage to the renal tubules. So coming on towards the morphology, the histological picture reveals interstitial edema and presence of mononuclear cells, neutrophils, eosinophils, and mast cells in the interstitium. The mononuclear cells include lymphocytes, plasma cells, and natural killer cells. Moreover, there is tubulitis, which is characterized by the presence of lymphocytes inside the tubules and inflammation of tubular cells. The necrotic areas are also present, and papillary necrosis is a typical feature of the disease caused by NSAIDs, in which the papillary epithelium are necrosed and glomeruli are mostly normal. But in certain cases, the disease caused by the NSAIDs results in glomerular damage, characterized by the excretion of proteins in the urine known as proteinuria. You can see in the diagram there are multiple types of immune cells such as mononuclear cells, there are neutrophils and also eosinophils in certain cases. So the signs and symptoms typically appear almost after the 15 days of the exposure to the drug, and the symptoms include fever and rash is present in almost 25% of the cases. The blood picture reveals eosinophilia, and urine analysis also reveals hematuria and proteinuria, which is due to the glomerular damage, and hematuria is due to tubular damage. The urine might also contain some leukocytes due to the inflammation, and 50% of the cases also present with acute kidney injury, which is characterized by decreased urinary output known as oliguria and increased blood urea nitrogen demonstrated by increased creatinine level in the blood. Withdrawal of the drug causes complete recovery and the symptoms reappear on re-exposure. So this concludes our section of acute drug-induced interstitial nephritis. If you have any questions, do let us know in the comment section. Thank you.